Have you ever heard the theory that shockwaves could be used to treat and eliminate erectile dysfunction? Well, what if it was no longer just a theory but actual fact? It is arguably the most common form of sexual dysfunction, affecting more than 50% of men above the age of 40. Some studies estimate that more than 152 million men worldwide are living with erectile dysfunction or ED. The good news is that there are steps you can take to treat this condition, and in this video, we are going to explore how shockwave therapy might just be the next best thing. You are going to literally and figuratively be shocked by some of the stuff we have in today's video. Are you ready? Well, let's get down to business. Let us kick off today's list with something you may not want to hear so soon. Number 6 is exercise. Exercise is one thing that people are constantly advised to take on, but most are too lazy to keep up with it. While it can be quite challenging, exercise is an essential part of your body's proper function, and most importantly, erectile function. How does it work? While there are a few different ways exercise can negate the effect of erectile dysfunction, the first point of contact is with the blood vessels. Did you know that a healthy erection is heavily dependent on the proper function of certain blood vessels? Considering that an erection is the result of blood flowing to and staying in the penis. An alteration to seamless blood flow toward your penile region is a solid setup for erectile dysfunction. It is a pretty obvious cause and effect situation, but this is where exercise comes in with its first two major functions. First, exercise gets your heart to pump more blood, even when you are not performing any physical activity. Secondly, exercise allows the blood vessels to dilate, and the capillaries open to allow for the free flow of blood to the important areas. In summary, the healthier your blood circulation is, the better your chances of defeating erectile dysfunction. Other bonus points to help convince you if you are still reluctant about getting on that treadmill. Exercise helps reinforce the muscles in your pineal region that maintain erections for longer. Furthermore, exercising can help address other health issues like heart disease, diabetes, and hardened arteries that are generally dangerous but also affect healthy erections. The best part is that you do not have to lift weights or perform leg day if you do not want to. Pelvic floor exercises, Kegel exercises, and regular aerobic exercises would be a great place to start and ease yourself into the system. While we are on the topic of blood flow, our number 5 pick is an option that you are most likely not paying enough attention to. Foods high in nitric oxide. Nitric oxide contributes heavily to the proper flow of blood in the body. So, a healthy presence of this compound will aid the relaxation of smooth muscles in the blood vessels. As a side note, this is an important part of healthy erectile function, as well as heart and general body function. Another big point for nitric oxide is the role it plays in the production of testosterone. Apart from the role it plays in helping the body create testosterone, it also affects the hormone that manages your body's testosterone levels. Overall, nitric oxide, while not the most popular compound, is one of those subtle but heavy-lifting components of proper body function and erectile performance. It is worth mentioning that there are supplements that you can use to get your nitric oxide level up. However, if you do not like to swallow pills, there are other options to explore, including food. But just before we get to the list of foods, we have got a fun fact that will shock you. Did you know that simply enhancing your nasal breathing could help boost your nitric oxide level? Does not make sense? Well, let me explain. Nitric oxide is constantly discharged into the nasal airways after production, in the paranasal sinuses. Therefore, breathing through the nose allows the nitric oxide to easily transport to the lungs and other parts of the body where it is needed. As for foods, the best places to get your nitrate content include vegetables like spinach, bok choy, and lettuce. You could also add beets, carrots, and garlic to the mix to keep things interesting with your diet. Bonus additions to the list include dark chocolate, citrus fruits, pomegranate, watermelon, and nuts. With this wide variety of dietary options, you can enjoy great meals, keep your nitric oxide level up, improve your erectile health, and stay nourished all in one blow. Number 4 may not come as much of a surprise, but it is hurting you in more ways than you would think. Number 4 is cut out of alcohol. Getting and maintaining an erection is heavily dependent on a couple of factors in the human body. From the brain to the hormones involved to the aforementioned blood vessels, and of course, nerves. Once even one of the processes in these areas is altered, this could affect erectile function. And, newsflash, alcohol consumption touches all of these points. So, while you may want to pride yourself in being an avid drinker, it is safe to say that you are also setting yourself up for erectile problems. Shockingly, alcohol can have immediate short-term effects on your erections. Some studies have proven that alcohol depresses the ventral nervous system of the body, thereby causing a lag between your brain and penis. This could cause slower to no response to sexual stimuli by the penis. Another possible alcohol-related cause of short-term ED has to do with urinating. The diuretic nature of alcohol means that it causes dehydration, increases urination, and increases the level of angiotensin in the blood. This hormone narrows the blood vessels and limits the flow of blood. On the other hand, consistent heavy consumption of alcohol over a long period could irreparably sabotage important blood vessels and nerves. And as we mentioned earlier, the human blood vessels are extremely important to get a solid erection. So, if you have been experiencing frequent erectile dysfunction, then checking and cutting your alcohol intake could go a long way, especially if you have any other underlying issues. Now is a great time to remind you that our number one pick is a method that will blow your mind, so stick around for that. For now, the next thing on the list is yet another lifestyle-related entry that you have most likely heard of before, but are not paying enough attention to. Number 3. Reducing stress levels. The relationship between stress and erectile dysfunction is a tad tricky, but we'll explain. Chronic stress and anxiety create a constant feeling of pressure and extreme overwhelm over an extended period. Continuous exposure to the level of pressure that comes with chronic stress can expose your body to a plethora of conditions that have been connected to erectile dysfunction. Whether it's heart disease or high blood pressure or the just discussed excessive alcohol consumption, chronic stress could lead to any one of these, and they could, in turn, lead to erectile dysfunction. But for a more direct approach, this is where it actually gets tricky. Stress and anxiety are mental health conditions, and they alter the brain's ability to transfer signals to other parts of the body and cause physical reactions. With that being said, the reactions that come from extreme stress could break the transmission signal between the brain and the penis to facilitate extra blood flow. From this point, it is bound to spiral into a vicious cycle. ED presents the problem of being unable to perform sexually. This problem causes more stress for the patient, which, as we have just mentioned, causes problems with proper erectile function. Up next is a dietary option that you may not be getting enough of. Number 2 is folate consumption. You would think that as popular as folic acid is, it would be at the top of the list of most consumed vitamins, but sadly, it does not get that designation. Before we dive into the deeper stuff, we just have to put it out there that folic acid is an important part of a healthy body. And before you ask, the answer is no. Folic acid is not only for pregnant women, it is just as great for pregnant women as it is for everyone else, thanks to its nutritional content. Research has found a pretty strong connection between men with erectile dysfunction and low folic acid levels. Another fun fact to take with you is that low folic acid level has also been connected to premature ejaculation. What has been found to be the line connecting these dots is the amino acid known as homocysteine. With above normal levels of this homocysteine acid, you could be at risk of cardiovascular diseases and endothelial damage. Consider the endothelial cells as the backbone of the inside lining of blood vessels. And if you have been following so far, you already know that damage to the blood vessels is one of the leading causes of erectile dysfunction. Whether you think about it from the angle of affecting blood flow or slowing down the production of nitric oxide, it is a big deal. The release of homocysteine in the system is usually a result of the low folic acid levels in the body. So if you are going to keep this acid under control within your system, you are going to have to consume more folic acid. There are also a couple of options when it comes to foods that are high in folic aid. Leafy green vegetables like broccoli, spinach, asparagus, and lettuce would usually be the first point of contact when it comes to folate consumption. You could also get your folic acid content from seafood, eggs, milk, as well as other dairy products. At the very top of today's list is a very shocking addition to the list. In number 1 is Shockwave Therapy. Yes, you heard that right. Shockwave Therapy. If you are shocked by this entry, stick around. Let us help it make sense. Shockwave therapy is a treatment method that has been in use for quite a while. Its major application is as a non-invasive treatment plan for kidney stones and orthopedic injuries. More recent studies started testing its effectiveness in treating erectile dysfunction. Some physicians still consider the relationship between shockwave therapy and erectile dysfunction to be experimental, so it may be considered a last resort for people who have tried other forms of medication or do not want invasive treatment methods. Still, there is some solid evidence that shockwave therapy can be effective in treating erectile dysfunction. The process involves the use of a small device that sends out directed sound waves to help revive the unresponsive tissues in the penis and facilitate blood flow. Furthermore, the subtle shock waves that the machine produces have been found to grow new blood vessels, thereby enhancing the dispatch of blood to the penis to form an erection. If you learned something new from this video, be sure to hit the like button and share it for more people to see it. Don't forget to subscribe for more videos like this. And while you are here, you should definitely check out the video on your screen right now. Catch you there.